When patients come to Riverside, I think it's important for them to know that people at Riverside really care. It kind of goes along with our mission statement, caring for others as we would care for those we love. And I always tell patients that at the end of the day, when I'm making a treatment decision, I always say, what would I do for myself? And what would I do for a family member? And I think that, I'm not the only person who does that. I think every person that, works in this office is really approaching their patients from that perspective, that this is how I would treat somebody that I care about. When patients walk in the door, there's a lot of anxiety. Obviously, you hear a cancer diagnosis and your whole life feels like it's something out of control. And it's really kind of amazing in that first visit with patients that you start talking to them and you're giving them information that's helping them form a roadmap as to their future. And you're saying, okay, I know your life feels out of control right now. Let's figure out how we can take the next steps together. And you can actually watch people's anxiety kind of de-escalate during those visits, and you can see them starting to say, okay, I understand what I'm facing now. I have a plan, and we can do this. And I think that's very rewarding because, you're helping people see, there is a chance and there's a future. With cancer treatment nowadays, because cancer treatments are becoming better and better, you get to know your patients for a really long time. And so they're not with you just for 6 months, not just with you for 6 treatments, they're with you for their entire life. And so as they move out of their treatment into recovery, into remission, you remember these things. And so they come back a year later and you're like, how was that trip to Disney World? How are your grandkids doing? And that's really special to have that relationship and to be able to continue that for years on. So peer communication is extremely important in oncology. I always tell patients that oncology is a team sport. We work really closely with the surgeons, the radiation oncologists, other medical oncologists at other institutes to come up with a treatment plan for patients. And every week we actually have something called tumor board, where we sit down and we actually discuss some of the cases that might have some more tricky situations, might need a little bit more collaboration. And it's nice because in real time, you can actually talk to other specialists to figure out a game plan together. I think one thing that's very important to me is patient autonomy, especially when it comes to cancer treatment. Everybody's had a family member or a friend who's received chemotherapy in the past, and so they know some of the side effects that can come along with treatment. And a lot of times patients come in the door afraid that you're going to kind of push them into doing something that they don't feel comfortable with. And so whenever patients come in, I tell them right up front that, hey, at the end of the day, it's your body and I respect your choice and I'm not going to make you do anything. My role is really just to give you information. I'm going to tell you, where we're at with things with the cancer and then what your treatment options are and the side effects. And, it's your decision and whatever you decide is 100% fine with me. I'm Dr. DeRidder, and I'm a medical oncologist and hematologist at Riverside Peninsula Cancer Institute.